मेरा नाम डॉक्टर सैयद रियाजुल हसन। मैं पाका इंस्टीट्यूट ऑफ डायबिटिक एंड साइंस में एज ए फिजिशियन और सुपरवाइजर फॉर पोस्ट ग्रेजुएट ट्रेनिंग हूँ। और यहाँ मैं नवाब शाह पाकिस्तान स्टडी फिजिशियन में क्लासिक चैप्टर का हेड हूँ। और इसी हवाले से जो पाकिस्तान स्टडी और फिजिशियन के जो क्लासिक के जो आज प्रोग्राम नवाब शाह में हो रहा है, इसके लिए हम लोग सब यहाँ कराची से आए हुए हैं। बेहतरीन किस्म का प्रोग्राम हो रहा है और हम सब काफी इंजॉय कर रहे हैं। इसमें खसूसी तौर पे हम निगिरिक फॉर्मा का जरूर शुक्रिया अदा करेंगे कि हमेशा वो हमारे साथ कोऑपरेट करते हैं और प्रोग्राम को कामयाब करने में हमारे साथ पेश रहते हैं।
Great, great, great. So, okay, sir. Since you are you work with the diabetes and everything.
I basically not work as a diabetologist. I work as a physician. I am basically a postgraduate trainer for the FCP as a student of medicine. That
Okay,
is
for medicine.
recognized for the diabetes enterprise, but I have inducted because try to establish a unit which trains the students for postgraduate training of FCPS medicine, not diabetes or enterprise.
Okay, sir. Just a few questions regarding your clinical practice. What are the most common cardiometabolic conditions you encounter in your patients?
The common metabolic is one of the only thing everybody is talking about is the obesity. It is the thing that leads to diabetes, that leads to dyslipidemia, that leads to hypertension, and then it leads to all the complications related to that. Whether you talk about the heart disease, you talk about kidney disease or brain, whatever you name it, you start with obesity and all this, the cascade is around that obesity. So I personally feel that those who have got obesity tend to have more diabetes, and then more diabetes, and this is what we all commonly see in our common practice.
Okay, there is a common notion that this obesity is more of a hereditary. You know, it runs in the family.
It was, but now it's because of the lifestyle. Even you can see the young individuals have a sedentary lifestyle, their eating habits, there's too much junk food. So it's not only the family matters. Now it's becoming an epidemic. It's not only the family, the genetic does play a role, but it's not only nowadays. Not only the genetics.
So is it related to our eating habits? We eat more and we don't burn it.
We eat junk food and stuff which is not very healthy. We don't eat most of the Pakistani are more fond of eating junk food and oily things rather than they really seem people who are eating more fresh foods, vegetables. That even the young individual doesn't like to eat fruits. If you talk about which fruit they prepare, even they, I think they don't know the names of this.
Right. So, this cardiometabolic disorders and mental issues. So like you said that it starts from obesity. So since the obesity is there, so the mental issue starts with that as well.
See, the prevalence of in the lectures you have seen that so many people are having anxiety and depression, all these things. So it's going side by side. Those individuals who got obesity have more chances of having anxiety and depression. Those individuals who got anxiety and depression, they're using certain drugs, their lifestyle, they tend to develop obesity. Obesity leading to anxiety and depression, anxiety and depression leading to obesity. They go hand by hand.
Mm-hmm. So, sir, how do you consider you just making such awareness programs, and most of the audience is the doctor. So, do we as a nation need to take it to the public as well?
So these are the good institutions. I think people are doing seminar in the hotel is not a good thing. In these institutions, you have young doctors, even the students. These students, we need to address these messages to both the students and the younger level. We should go to the school and colleges also, so that we can spread the message to the grassroots level. And so it's a good thing to do a symposium in a university college so that the students can benefit it. But we are totally agree that these programs should be done also in in the society level so that we can spread the message.
Thank you very much, sir, for your time.